Well, today is Wednesday. It is the 14th of October.
I hence your hesitation. I'm with you, man.
Well, it's going so quickly I can't keep up with it. Anyway, it's the 14th of October. It's Wednesday, middle of the week already. This is Wayne Goldsboro Television. I'm Wayne Alley.
And I'm Kate Daniels.
Yes, you are. And I'm glad you're here because today is another day.
Today is another day.
We are in the middle of the week already.
Somehow. And in the middle of October. It's the middle of October.
It is the middle of October.
Slow down.
Which means we have roughly 10 weeks until New Year's Day.
That's wild.
That's something, isn't it?
That's wild.
Only a fifth of the year remaining.
9 Fridays until Christmas.
Whoa.
Is that right?
Yeah.
That'll make you go, what?
Yeah. Gee.
Yeah.
So if you haven't started your Christmas shopping yet, and I haven't.
Do you usually start early? I'm not good. I'm not last minute the day before, but I mean, now's the time that I start thinking about things.
Mm-hmm.
And you know, if you haven't finished all of yours, join the club, but do so locally. Please don't just jump online and order your gifts.
No, I used to.
And so did I. I mean, it was, you know, it's sometimes it is a matter of convenience, and we get that in our head that it's so easy. But you know what, if you think about the ripple effect of what happens now that so many people are going online, you're seeing smaller stores close their doors because so many people are going online. And most of the time you can get it at the same cost in town. It might be a little bit extra, but think about what that local business is doing for your local economy.
That is so true.
The more we can do to support local, the better off our community. I got a new license plate a couple of weeks ago.
What does it say?
I've always wanted a personalized license plate, and I finally found one that I thought, I want to do this. And I was very excited when I and you do have to do this online. You can't do this in a store. But when I keyed it in, I was like, oh, that's clear as day. And then when I put it on my car, I was like, I'm not real sure that that's clear. It says shortened support local.
Support local.
Support local.
Support local.
Well, the short for support is SPRT or SPT. So I thought if I did SPRT LOCL, it might look like sport local or sport something. Mm-hmm. So I spelled out local, but it's SPT.
SPT.
LOCAL.
Right.
So somebody said spit local. No, not spit local. Spot local? Not really.
No.
But it is support local.
Support local.
Hoping that it's that mindset. And you can take it however you want to. Support local business.
Right.
Support local law enforcement. Support educators. Support, however you want to look at it. Churches, whatever it floats your boat. I hope that as I'm driving around Wayne County, it makes you think support local.
So when you see that license plate on the back of a vehicle that says
local.
spit local or spot local, it is actually support local, and you know that is Kate Daniels, right?
That's right.
All right. We have a full program today. We're going to go out to the Senior Center and talk to the ladies with SHIP.
Great.
SHIP. Okay?
Okay.
And we'll be back after this segment. Your source for what's happening in your community is Wayne Goldsboro Television. Today we're at the Senior Center on East Ash Street in Goldsboro. We're here talking with Lisa Barker and we're talking with Peggy Tate. Now, Lisa, what do you do?
I am the Information and Options Counselor here at the Senior Center. So that means I do a variety of whatever the seniors might need with providing information and options that would be available to people in the community. And one of the big things that I will be doing now for the next 6 weeks, starting October 19th, is working with open enrollment for Medicare Part D.
Okay, and here's Peggy Tate. Peggy, what do you do?
I'm a SHIP counselor.
Watch it.
There we go.
Watch it, lady.
SHIP counselor.
SHIP counselor.
Yes.
Ahoy there, matey.
And I work year-round. I work by appointment on Wednesdays. Mm-hmm. And during open enrollment, we work a lot.
Okay, SHIP, what does that mean, SHIP?
Seniors Health Insurance Information Program.
SHIIP.
Yes, and it's administered through the Department of Insurance in North Carolina.
Okay, what does that have to do with Medicare?
We are Medicare counselors. We also do a little bit of state health plan support and making sure we are We don't have a dog in this fight at all.
So you
We make sure people have unbiased opinions,
Got
or
it.
not unbiased opinions, unbiased information, so that they can make good selections.
Okay, that's good. Now, so it's Medicare is so big and so large and
It
so
is.
convoluted and so confusing to some and everybody, and there's just a lot to it. So you're here to offer information and to help people make
Informed decisions.
informed decisions.
Yes, that's correct.
All right. So you mentioned October 19th. Why?
Open enrollment happens annually for Medicare Part D during October 15th through December 7th. However, our agency will be staffing October 19th through December 7th, Mondays, Tuesdays, and Wednesdays from 9 a.m. till noon on a first-come, first-served basis. So that's a good time for people to come in and compare their plans. Every person who is on a Medicare Part D prescription plan should compare their plans and make sure if their medications have changed every open enrollment period. So if they would like to come into the senior center and have a person look at that for them, one of these SHIP counselors, we will be here Mondays, Tuesdays, and Wednesdays from 9 to noon on a first-come, first-served basis. Again, from October 19th through December 7th. The changes don't take effect until January, so there's no reason for every person to come in the first 2 weeks that we start. So I've encouraged people, they can even come in November and they'll still be fine to review and or change their plans.
Okay. Now, I would think or presume that most people have heard of Medicare. Most people do not know all the details about Medicare, even those who are eligible and receiving benefits of Medicare. So let's get into the weeds here. I want to find out more about Medicare. Now, we're talking about between October 15th and December 7th, only Part D. Is that correct?
Correct.
Only Part D. Now, what is the difference between A, B, C, and D?
I'll give you a brief information.
Thank you.
Part A is your hospital coverage.
Okay.
Part B is your doctor or your medical coverage,
Okay.
as well as coverage for durable medical equipment and your diabetic supplies.
That would be like wheelchairs and crutches and shoes and diabetic supplies, that sort of thing.
Yes.
Okay.
Part C is what's called an Advantage Plan, and an Advantage Plan takes over your Part A and B. You still pay for your Part B, but your Advantage Plan, and you've also heard it maybe called a Medigap, but the Advantage Plan is a Part C, and again, that takes over your Part A and B, and also has prescription drug coverage. And then Part D is specifically for your drugs, your medication.
D for drugs.
D for
So
drugs.
someone could take advantage, or someone could be enrolled with an A and B and D,
That's
Yes.
correct.
or a C covers everything.
Correct.
That's correct.
What would be the difference between A, B, and D and C?
Well, in brief, Part C is administered through different vendors. And you have to make sure that the Part C plan that you choose, that your doctors, your hospital, your specialists all accept that particular coverage.
Oh, okay.
I don't know of a doctor in town that does not accept A, B, or D.
Okay.
Okay,
Most or all will accept A, B, and D.
that's correct.
But we don't know about C. Some of them may, some of them may not.
And because it is an individual practice, doctor's practice decision, they can decide to participate in any of the plans or they can exclude any of the plans. They decide.
Is everyone who is eligible for Medicare, can they make their own decision as to which way they want to go, whether it's Part C or A, B, D? It's up to them.
Absolutely, certainly.
But they may not be able to take advantage with
Sure.
the local physicians.
Right.
Correct.
Okay, all right, I've got that. That's good. So let's talk about the Plan D, which is the enrollment thing here. Now, you'll be open 3 days a week for people to come in and decide which. Now, what would a person who came in, why would they want to change?
Well,
their
it could
plan?
be that the plan that they had for the calendar year of 2015 has changed. Their premium may have increased. Their drug cost may have increased. They may have a deductible with their plan from 2015 that they didn't have when they signed up for it originally. They may have it for 2016. So it's always, always, always a good idea to check and see, am I in the best plan that fits my budget, that fits my needs?
You know, I see a lot of advertisement on television about the Medicare plans.
Oh, yes.
And at the end of those advertisements, you see that it's actually an ad for an insurance company.
Certainly.
And it's not for Medicare. I mean, Medicare is not paying the bill for the ad.
Right.
So it's the, am I right in thinking, is my thinking right in that you're actually dealing with insurance companies and not specifically with Medicare? These insurance companies are actually the ones handling the Medicare?
Yes, they have
Okay.
to be approved by Medicare to offer the plans.
Okay, so it might be insurance company A versus insurance company B. And thereby, that's the reason for the differences in the cost of the medications.
Certainly.
And I see. Oh, it's coming home now.
Now,
Okay.
one of the things when you're talking about difference in price of medication, not only will you have Plan A would be different. Let's say you have Plan ABC, which, maybe you have Plan XYZ. Now, your spouse may need to have Plan XYZ because they're on these 5 medications, but you want to be, or it works best for you to be on Plan ABC because you're on these 6 medications or these 2 medications. So even a husband and wife, a brother and sister, somebody who lives in Wayne County, somebody who lives in a different county in North Carolina, just because your loved one likes that plan or your neighbor likes that plan, it doesn't mean it's the best plan for you. You really need to evaluate the plan specific to yourself and your medication. The other thing is with your Plan D, there are also preferred pharmacies. And with each plan, it's different. So let's say you go to a certain pharmacy and you want to stay with that pharmacy. We also want to look at, would there be a cost difference for you if you're going to a standard pharmacy versus a preferred pharmacy? And we can let you know with your medications if there would be a cost difference for you.
So you have all this information, and you advise people who say, well, I'm paying a lot. This medication for me has really gone up. And so you look up another plan offered by an insurance firm
That's approved by Medicare.
that's approved by Medicare who may have the same medication at a lower cost.
Certainly, yes. Each vendor sets their own formulary. When a formulary is all the drugs, and they assign them tiers. Tier 1 generic.
That's not tiers?
Not tiers.
No, it's
layers.
Layer, T-I-E-R-S. Okay.
That's correct.
I have a lot of tiers.
Yes.
Okay.
They can assign any drug to any tier on their formulary.
Okay.
So it does take a little bit of shopping. It does take a little bit of comparison shopping to make sure that you're in the right plan that gives you the best bang for your buck.
The best bang for your buck, and that's what it's all about.
Yes,
Is
saving money.
because this is coming out of your pocket.
Yes.
You're buying medication, and there are ways to actually save money.
Certainly.
And when the price of medication goes up, you need to shop around.
Sure.
That's what you're doing here, right?
That's what we're doing.
Shopping around. And if your plan is the best there is, then you keep it. And if you want to change, you can.
That's correct.
But you can only do that during the
Open enrollment
Exactly.
period.
Yes.
And the important thing when you're evaluating it, during open enrollment, which is October 15th through December 7th, but our dates will be October 19th through December 7th, is when you're evaluating those plans, the most important things that you need to have that you're going to bring into the senior center with you if you are coming in to visit us would be your Medicare card.
Yes.
And either all of your prescription drugs in a bag, we can look through them, or a list that includes how many times a day you take them and your milligrams. So when we're evaluating that and giving you the unbiased information about the different plans that would be best for you, in order to be able to get access to that information, we need to have your Medicare card and your prescription information.
We also can check at the same time that you're in, making sure that you're in the best Part D provider plan. We can check and make sure that if your income and asset levels fall within certain ranges, we can get you some additional help in paying for your prescription drugs or paying even for your premium to be in the plan.
times are difficult now for a
Yes,
lot of
they
people.
are.
They're really tough because the cost of everything continues to go up. But the income does not go up at all. In fact,
Yes.
in many cases, what you're receiving, your income is lower, or it continues to drop. So people are having to make tough decisions. Do I buy food? Do I buy medicine? Do I buy gas for the car? Do I pay this bill? It's tough.
Yes.
So you can help them with that. You can help them in the case of the Medicare, decide which is the best plan for them.
Certainly, and if they are eligible for extra help, we can help them with the application. Do the application online, which is a little bit faster than the paper application.
Some of the pharmaceutical companies offer assistance in payment. Or
Yes, some of the
offer drop
Yes.
prices and such.
patient assistance programs. There are several different sources we use to check and see if we can find help for them. Each one of those programs have parameters that we have to work within.
What about state lines? Does anything change if someone moves here from, say, another state? Does anything change at all if they move, say, from Virginia, Utah, or even Greensboro?
Most definitely. You want to make sure that the plan for the area that you live in is the best coverage that you have, especially state to state.
Yes.
So in North Carolina, you're going to find that the coverage is pretty similar, even if you're from county to county. We have some people that live close to the county line. They may live in Wayne County, but maybe they pick up their prescriptions in Lenoir County. That's not going to be a big deal. But if you have somebody who moves from another state, they do need to get their plan evaluated and then get their coverage transferred to North Carolina.
And I couldn't help but feel that that's one of the reasons would be because they're used to dealing with Mortimer's Drug Company in Fairfax, Virginia,
Right.
and there's not a Mortimer's here,
Right.
Exactly.
and there should be. So if your name is Mortimer, here's an opportunity for you. I just threw that in.
There you
I
go.
hope that's okay.
Yes.
Okay. Now, so between October 19th and December 7th, and the hours again,
9 until 12 on a first come, first served basis.
Monday, Tuesday, and Wednesday.
Yes, sir.
So people walk in and you say, take a number, have a seat.
We will have somebody at the front of the building when you walk in at a table that will have a sign-up sheet. They will sign you up with the time that you've arrived, your name, and making sure that you have your Medicare card. And then we will have usually 3 to 4 counselors that will be seeing people. So there's no guarantee that you'll see Miss Peggy Tate or I, but you will see somebody who is a trained and very capable counselor here at the Senior Center.
These are trained individuals. And like you said, you don't have a dog in this fight.
Nope.
Nobody's paying you to do this.
Nope.
Right.
We're getting information so people can make good, informed decisions.
Okay, now, is it possible that there are other places or other people in the community who are offering advice like this but charging for it? Does that happen?
I don't know. Certainly that insurance companies do receive lists of people's age so that they can go out and call on people.
Yeah, you ought to see my mailbox.
Exactly.
You know, and I'm only 25 years old.
Yeah, we believe that.
Thank you very much.
You're welcome.
I would be very cautious if you are seeing commercials on TV that say, call this 800 number, it's the best thing since sliced bread. And I would be extremely cautious if somebody knocks on your door and says, I have this wonderful new insurance that would be the best thing for you. When somebody does that, I would say go ahead and leave the paperwork on my front porch. I will discuss it with my family member or bring it in here and talk with somebody at the Senior Center about it. But when somebody is from an insurance company or is an insurance agent and they're going door to door, they obviously have some potential financial gain in that situation. Much like if you call the 800 number, that is calling a specific insurance company. By coming into the Senior Center or by calling the SHIP 800 number or even by going to Medicare.gov, those things are unbiased. Those things are just going to compare the plans that you say that you'd be interested in for Medicare Part D, not one specific company.
Okay, now I don't want to give anyone the idea that we are anti-insurance companies.
no.
Oh, no.
But there are people out there who might take advantage of the moment, of the situation.
Yes.
Not the insurance companies necessarily. So
Right.
want to make that clear right away. But again, October 19th through December 7th, 3 days, Monday, Tuesday, and Wednesday. come on in. There's trained professionals here to help, right?
There certainly are.
All right. Now, so you mentioned Medicare.gov. That's the official Medicare website
Yes.
with all kinds of information.
Yes, when people come in to have their Medicare Part D reviewed to receive information, we actually go to Medicare.gov, and there is a button that you click on that says Find and Compare Plans, and we click on that button, and then that is when we take people's personal information on their Medicare card and put that information into the computer, and we're able to compare the plans that way. So if you have somebody who is computer savvy or comfortable with the computer, they are more than welcome to have from their own home or from somebody that can get access to the internet to look on Medicare.gov as well. They can research those plans very similar to what we can.
Yes.
And basically what we try to do is when people don't have access or don't understand what they have access to, we try to explain and just kind of break it down to what the top 3 options for them might be.
I would think that it would be more of the latter. People have no idea what they're looking at. I know I wouldn't.
Right,
There
and
you
that
go.
is, I've had people that have gone and looked, and unless they have a bit of a background in insurance or are real computer savvy, sometimes it gets a little confusing.
It does get a
Sure,
little
they'll come in
confusing.
and say, I've looked at it, but it confused me more than when I didn't see it at all.
Yeah, and you can clear all that up for them.
Yes, we
Yes.
can.
All right, now what about a phone number? Is there a Medicare phone number?
If they are wanting to reach the SHIP hotline, if
The
they
SHIP
come in
hotline,
and when they find that we are too busy here or they can't get here Monday, Tuesday, or Wednesday, they can call the SHIP hotline, and it's 1-855-408-1212.
Oh, okay. Now that's a toll-free number.
Yes, it is.
Toll-free, doesn't cost you anything. 1-855-408-1212. 1212.
Yes.
They have SHIP counselors, probably 20 or 25 SHIP counselors that work the phones at the SHIP office in Raleigh. So you might be able to get a faster answer or faster information than coming here and waiting for a counselor.
So that number goes to Raleigh then? It doesn't go to
yes.
D.C. or anywhere
Oh,
like
no.
that?
No,
No.
Okay.
it's local to North Carolina, but it is in Raleigh.
Okay. 1-855-408-1212.
Yes.
Correct.
Very good. What else do we want to add anything else to this, or have we covered just about everything?
No, I just want people to know that they can come in and that we will help them the best that we possibly can.
And she summed it up perfectly. So we look forward to seeing whoever would like some assistance Monday, Tuesdays, or Wednesdays from 9 to noon. And we will do our best to provide the information, and they can make the choice at that time.
There you go, and it all begins on October 19th with Lisa Barker and Peggy Tate here at the Senior Center at 2001 East Ash Street here in Goldsboro on Earth. Okay, and ladies, we thank you so much for being with us today.
Thank
I appreciate
Thank you,
it.
Wayne.
Thank you. Bye-bye. Thanks for watching. This is Wayne Goldsboro Television, in the heart of Goldsboro, in the heart of Wayne County. We're back on Wayne Goldsboro Television, Wednesday, the middle of the week already, and it's the 14th of the month, and a lot of stuff going on around the area. Moving right along on our streetscape.
Yes.
Wow. Got the F-86 in place, got the fountain in
How
place.
amazing is that? And the fountain running, and you know, if you've not made it to downtown recently, you're in for a big surprise. It is in the short road
It is.
for completion of downtown. So can't come soon enough for the many businesses downtown.
That's right.
And it's gonna be really good for our entire community.
They're laying out the sod in the median, and it's just it's really moving. It's already beautiful down there. The fountain going and everything. Well, let's see. Today is the 14th. Did we do that already? Be bald and be free? I think we did.
We did have that another time.
I may have read that too soon.
Oh,
Yeah,
you got a
anyway.
little excited.
I did. Anyway, today is Emergency Nurses Day, National Dessert Day. I may have read those already.
No, I've not heard that one. I would have remembered
National
that
Dessert Day?
Yeah.
Oh, yeah. What's your favorite dessert?
one. Anything chocolate.
Really?
Anything.
I'm a chocoholic myself.
Anything.
Anything chocolate.
Yeah.
All right. And ice cream.
And ice cream.
Yeah, I love ice cream. And well, never mind that. Anyway, I mean, we could go on about that. You know what I'm saying? Saturday the 24th, we have the
Chili
chili
challenge.
challenge coming up.
The really chili challenge.
That's right. The really chili challenge.
And you know, it is, you know, it was the season of the fair. We've had the Taste of Wayne.
Yes.
We've got the chili challenge coming up. Fall's a busy time. There's a lot of things going on at churches around town with fall festivals. We've got Dancing Stars coming up
That's
on
it.
Friday. So we are
That's
2
this
days.
week.
Yes, we're 2 days away. And
Wow.
Dancing Stars, we are working to raise money to support education in Wayne County.
Yes.
And there's more information online, WayneEducationNetwork.org, or the Chamber's website, WayneCountyChamber.com. And we've got 16 stars that will be on the stage. Tonight we've got our first run through, and I cannot wait. It is a lot to ask a grown professional to say, come on back to high school days and dance on a stage with these incredible dancers at local dance studios. And they've done it, and they've kind of pushed egos aside, and they've made the time for it. They've made the commitment. They're raising money for education, and it is an incredible lineup. I think it's going to be the best year yet.
I think so. And when you
Yes.
say professional, you're not talking about professional dancers. You're talking about professional professions.
Yeah, business professionals.
Doctors, lawyers,
Yeah.
Indian chiefs, all those people.
Indian chiefs,
Well,
all of it in between. But you know, it really is. It just goes to show, because we've been posting on Facebook, and I had somebody from out of town private message me, how do y'all do so much in the community to get people to say yes to do this? There's something in the water here, and it really is. And sometimes you can ask and they tell you yes immediately. Other times there's persuading going on and begging,
Begging, it
maybe a
works.
few tears.
Tears are good.
Yeah, but it really is neat. So if you can't come out Friday night, you can still go online, vote for your favorite star. It's
right.
$10 a vote, but we would love to see you.
So what is that website address?
WayneEducationNetwork.org.
WayneEducationNetwork.org. Place your vote.
Yeah.
Only costs you $10 per. And what if they wanted to go? It's $75 a ticket.
$75 a ticket.
Yeah.
Of that $75, $50 is included for you to vote for your favorite star.
So you get 5 votes?
So you get 5 votes because they're $10 a piece. Heavy hors d'oeuvres catered by Ed, Southern Foods and Spirits.
Oh boy.
Yes, and of course the live show. So we've got some tickets still available, and we want to pack out the beautiful downtown Paramount Theater.
Yes. Yes. That's going to be so much fun.
It is.
Okay. Don't forget the Farmers Market Wednesdays and Fridays. That's today. And this Friday, open until November 25th, and then they will close down for the winter, and then be back in the spring. There you go. And what else do we have here? We've got the Partner Celebration, 2015 Partner Celebration.
And that is for the communities and schools of Wayne County. And the executive director, Selena Bennett, is a good friend of your show and a mighty special partner in Wayne County. She is touching a lot of lives, your communities and schools, and the many coaches that are in the high schools.
That is so true. All right, today's program, we're about out of time here, so we'll do this again tomorrow. Join us again on Thursday for Wayne Goldsboro Television. We'll be back tomorrow morning at 7 o'clock. The show will then repeat at noon, then again at 5:30 p.m. So until tomorrow, I'm Wayne Alley.
And I'm Kate Daniels.
And this is Wayne Goldsboro Television Today.